Hello, hello, hello. Good morning, people. Come on in. Having another live today with Whitman-Walker. For those of you that know, I do lives with them every week. So we're going to be talking about something today. So hang in there. Thank you, thank you. Hope all is well with you too. Come on in. Waiting for our co-host, Sir David, who'll be joining us soon. Today we're talking with Whitman-Walker about some information. So hang in there. We'll be starting real soon. Good morning, everybody. I know. Good evening. Good afternoon. Hello, hello, hello. Welcome, welcome. Just waiting on Whitman-Walker to come on in with our co-host David. Good
Hey,
morning.
how
How
are
you
you?
doing?
I'm good. How are you doing?
Good. Relaxing day. Had time to brush my hair.
I wish I could say the same. Today's been busy.
Yeah. Work is crazy now. End of the year is coming. Everybody's still working from home. How you doing? So what's good? You ready for today's talk?
Yeah, I'm ready for today's talk. I think it's a very good topic. But I'm doing good, just balancing everything, balancing work, our new responsibilities,
Well,
everything.
so it looks like people are joining in. I already did the pin for us, so don't worry about that.
Thank you. I saw. Good job.
I've gotten used to like copying it right before we go in, so it's just ready, so we don't look like we lost. Because you look
Yeah,
at the camera like
I know you're like down there, like.
already mastered it. So yeah, guys, I'm Orlando, social media influencer with the Whitman-Walker. I go by he, him. I've been working with Whitman-Walker for a while now. Me and David started around the same time. You want to introduce yourself?
Yeah, and so I am David Wilson. I'm actually on Instagram as Sir underscore Dave underscore. I am also a Whitman Walker influencer. We do a lot of outreach work here on, Instagram. My pronouns are he, him, his, and that's that.
That's right.
So, want me to jump in?
Yeah, yeah. Go ahead and start that first part.
All right, cool. So, today we are going to be talking about body dysmorphia. And it's a very interesting topic, especially in the MSM community. Um, and so, like during the last few months, Women Walker's Community Health Department, we've expanded our outreach efforts to social media, i.e., here on Instagram. So we are covering various topics. Some of those topics include HIV, STI, sexual health practices, access to care, social determinants of health, and also just general health interventions. So our next series of outreach sessions, we focus on the current pandemic and COVID-19, ways to manage your sexual, personal, and mental health. And so our community team here at Whitman-Walker, we're here to educate you and we are here to support you.
Well, welcome, welcome for those of you joining us. So let's talk about body image. David,
Yes.
what is body
So
image?
what is body image? That's a good question. So body image is the perception that a person has of their physical self. So body image perception, it stems from, the thoughts and feelings that surround that perception. These thoughts and feelings are influenced by individual and environmental factors. So this can cause these feelings to be positive or negative or both. So in our culture, having the ideal body or figure, it's become an obsession, especially with like Instagram and all these beautiful models that we see on this platform. And so, that obsession is kind of heightened, and it makes it even more challenging because sometimes it's unrealistic.
Who are you telling? I'm glad I have a good personality. Look, because ain't nobody over here. There's a body.
Right, it's a body. So, it's funny. I love working out, but it's really, the most. I realized that all of my motivational factors of working out are all gone. And so I
Yeah.
haven't been going to the gym. Usually I like, work out because I know I'm going to be in a bikini on the beach
Right.
somewhere, but I ain't going to be on the beach no time soon. And so I'm just like, well, I'm going to eat these chocolate covered almonds and
I've seen your page. You look fine. You're doing good. Look, so how does this directly impact the MSM community? So for those of you who don't know what MSM means, it means males that have sex with males. So mostly homosexual, bisexual, really the ones who have that, mindset that, and some people do it because they like to be healthy, but some people do it because they're never satisfied with their bodies. So attempting to achieve an unrealistic body image is a driving factor in body dissatisfaction among men and women everywhere. There are high reports of body dissatisfaction in the LGBTQ community. It's reported that gay and bisexual men experience elevated dissatisfaction compared to the heterosexual men. 32% of gay and bisexual men report negative body image.
Yep, absolutely. And this elevated level of body dissatisfaction, it could be a result of, the greater emphasis on physical appearance in the gay community. We love to, you know, look at beautiful men. So studies have shown that this can cause higher levels of eating disorder symptoms. So increased likelihood of experiencing depressive symptoms and increased sexual anxiety and poorer sexual self-efficacy. And so I know personally, like you know, am impacted about my physical appearance, especially when it comes to having sex. You want to be comfortable. At least I do. And so I think a lot of people who are like, Orlando and I experience that.
Yeah, and I feel like this is why a lot of people like to, go drinking before they even try to let their inner sex addict come out. Again, like sex is sex, and we're gonna have sex. I feel like it's
Yeah.
super important to love yourself and not use substances because that's an easy way for like things to happen, unprotecting, and just being a little cautious with things going on around us. So it's super important to work on your mind, people. So body dissatisfaction has been shown to be tied. Hold on, it just took me away. Tied with sexual health constructs that center the body. Folks who are dissatisfied with their overall appearance may find sex challenging and anxiety provoking since attention is focused on their body and body parts. In a study done on gay men, lesbian and heterosexual men and women, 42% of gay men stated their body image negatively impacted the quality of their sex life.
Yep.
That's terrible. Enjoy
It
your
is
sex.
terrible, but
Let your
it's
body go.
real. It's terrible, but it is real. And like I said, I mean, I can speak for myself, but I definitely, if I feel like I'm a little, thicker than what I'm used to, it does impact you. And so when it comes to sexual self-efficacy, that can be described as a person's ability to assert their needs and desires in sexual situations, like I just mentioned. And so, an example of one topic that often comes up in conversation surrounding sexual self efficacy is condom usage. In this same study, gay and bisexual men who were dissatisfied with their body image had poorer sexual self efficacy, which predicted condom-less sex with serodiscordant male partners. So what that means is that these people who have these negative perceptions of themselves are less likely to use condoms because of it. So it's really impacting, uh, communities that look like us and that engage in sexual activities like us.
And I feel like they're trying to like compensate for not having that body. And like, oh, well, maybe if I don't protect myself, they'll want to have sex with me a little bit more, and that's
Yeah.
not the mindset we want. We want to be healthy. We want to stay healthy. Super, super good point. So we have a little help guide. If you or someone you know is posed with body dissatisfaction or body dysmorphia and would like help guides, please visit or participate in one of our resources below.
Yeah. And so if you, don't know if you need to seek help, there are signs and symptoms of body dissatisfaction or body dysmorphia. They can include, repeatedly checking your reflection in the mirror or staying away from mirrors altogether. It could also be isolating yourself from others, or isolating that particular body part, that you don't want others to necessarily see. It can also be spending a lot of time or energy camouflaging or covering up your perceived flaw, or going to lengths to avoid having your picture taken. And I've seen this happen in our community. And especially this next one, undergoing plastic surgery, sometimes more than once, to correct, that perceived imperfection. Picking at your skin compulsively, which may, lead to injury. Some people even obsess over their flawed body part and what others think about it. Sometimes people seek reassurance repeatedly. They compare themselves to others negatively. They may even experience feeling of depression or anxiousness, and could even lead to having suicidal thoughts. Also, putting a lot of effort into changing that particular feature with, excessive exercise, weightlifting, tanning, or, whatever. Spending a significant amount of time on personal grooming, that can also be a sign.
But don't forget to take care of yourself. Please groom yourselves. Take showers and stuff. Those are very important. But don't go out of
You
your way.
like, don't give up
People,
altogether.
you like taking showers. Everyone's like, "Ooh, that's me." Oh my God, I got my eyes done. That's me. No, those things are good. Things that make you happy for you, not because you're expecting someone else to
Yes.
judge you or want you even more because they think you. No, do things you love for yourself. Remember that. That's super important.
Yeah, absolutely. And it's okay. Like, it's okay to work out. Like, if that's your thing, let it be your thing, but make sure you're doing it for yourself. It's okay to eat healthy. It's okay to do any of these things that we've kind of mentioned, but you want to make sure you're not doing any of them excessively, and that you're doing them for healthy reasons and not necessarily for the approval or satisfaction of others. And that's the challenge with this. There's a thin line between, making yourself happy and doing things for your own personal happiness versus, doing it because of others and other people's perception, or what you think other people's perception of you are.
For sure. So if you recognize yourself from the list of the symptoms and decide to seek help, there is support available. First, give yourself credit for taking a significant step in seeking help. It's a huge step, and it should not be taken lightly. There are a variety of resources available, ranging from more informal practices and more professional supports.
Absolutely. And so what are some of those resources that you can refer to for support? So we mentioned self-help. Some self-help ideas is, you can practice mindfulness. You can try engaging your senses and pay close attention to, the task in front of you, to avoid allowing your mind to wander. You can ask yourself questions that are associated with that task, and what noise it makes, or what smell is it associated with. And so, for an example, for me, I tend to practice mindfulness when I'm reading. I put myself in the book. I really pay attention to how the pages feel, and what emotions the cover gives. Like, whatever that is, make sure you fully engage in that. It's really a way to overcome anxiety and those social pressures that you might experience. Another thing is, meditation. You can find a comfortable sitting position, to check in with your body and ask yourself, what am I thinking? What am I feeling? Spend some time acting on these feelings without trying to push any of those thoughts away. Close your eyes and direct your focus to your breath. Pay attention to the way it moves in and out. Breathe slow. Take your time. Try to clear your head. Spend a minute or two doing this. And then next, focus on expanding your awareness to the rest of your body. So, focus on your breath first. Pay attention to that. Do that for 1 or 2 minutes, and just pay attention to the rest of your body. How does that feel? How do you feel? The goal is to center yourself and take your focus off of, repetitive thoughts about your appearance, and just relax a bit. You can also reduce negative predictions. Once you become more skilled at, managing your thoughts, doing meditation, practicing mindfulness, you can also use these coping strategies to talk yourself down before you face a triggering situation. So the next time you catch yourself thinking the worst or expecting an event to go negatively, try writing down your worst fears in a diary. And so I don't necessarily have a diary. I have something that I call I have a jar. And what I do is I take a little sheet of paper and I write things down that I'm grateful for. I call it my gratitude jar. And then I throw it in there. And if I'm having a great day, I fill that jar up, right? Like, because it's been a great day. I got a lot of things to be happy about. I have a lot of things to be grateful about. And if I'm ever feeling down about myself or down about anything that I'm experiencing in my, life, I go into that gratitude jar and I read one of those positive things that occurred to me in the past. And that really it reminds me that, what really good things I have going for myself, my family, and my life, And so that's a good practice. But you can also do that by writing down in your diary and then reviewing those things when having trouble, getting rid of these negative thoughts. So once you acknowledge these negative thoughts, try coming up with, more realistic outcomes. For example, instead of thinking nobody will talk to you at that party you're going to, try maybe say, I will meet someone new and we will have an interesting conversation. You can make it a small target. Maybe it's just one person. And then the next time you go out, you increase it. Maybe it's 2 people. And then you just get more and more comfortable. Next thing you know, you're the social butterfly in the room. So keep your thoughts more realistic to encourage meeting a positive, reachable expectation.
I feel that's a great way to, like what we talked about earlier, like personality. Like, give yourself the opportunity to let people meet you. Stop thinking that they're going to judge you by your appearance. As much as, that's kind of how things have been in our community. It starts with us,
Yeah.
You look at, someone will look at you and be like, oh, they would never talk to me. I'm like, well, why not? Like, I'll say, I just love to say hi to strangers. I'm like, hi, how are you? And they're weirded out and they're like, oh, why are you saying hi? I'm like, well, I've never seen you and I don't know you, so I just wanted to say hi and, make somebody's day. And say hi to strangers. Like, if you're one of those people who feel lonely, like, just talk to strangers. I mean, don't be awkward, but, like, talk to strangers. Give out what you want. Like, if you say hi to someone, they'll say hi back, and who knows, maybe you have a new friend. You know what I mean? It's super mindful to stop thinking about what people see and start giving people something to think about, which is new characteristics that we give people. Let's talk, let's be nicer, let's normalize being able to say hi to strangers. You know what I mean? Without being awkward, especially in our scene. Trust me, it's super super hard. But yeah, piggybacking on David, professional resources. If you would like to seek professional support, there are psychological support systems and medical support systems that can help you improve your symptoms of body dissatisfaction or body dysmorphia disorder. Cognitive behavioral therapy, CBT. That sounds like something else, but no, it's not that. Okay. This is the only psychological treatment available. It focuses on changing the thought and behavior patterns set off by the condition. Your therapist will help you identify situations that cause anxiety, develop healthier coping mechanisms through CBT. You can learn to step outside yourself and view your body through a more objective and forgiving lens. The treatment process will also help you rewire the way your brain responds to triggers, help you decrease the compulsive responses. And medication. In the US, the FDA has not yet approved medications for body dysmorphia. However, serotonin reuptake inhibitors are very effective. These are forms of antidepressants that can help ease the obsessive thoughts and behaviors, reducing the symptoms of anxiety and depression, and put your mind more at ease.
Absolutely. And so if you have any additional questions about body dysmorphia or body dissatisfaction, or if you would like additional information regarding support systems or help guides, you can visit 2 websites that we have. So the first one is an NCBI website that I will post in the comment section. And then there's another one that is a help guide. So I will post those right now. But yeah, I think.
So anything else you want to say?
No, I mean, I'm just happy to be here, man. And it is not the easiest thing, being isolated. People aren't as active as they're used to because, we can't go out and be as social as we have been in the past. And I think it's important that we learn how to manage that during this time. And so I'm happy to see, like, we're happy to be here to offer some resources and provide a little more information about, maintaining yourself, maintaining your healthiness, mindfulness during COVID-19. What about you?
I mean, pretty much, guys, find something to take your mind off of, being sad or judging yourself. Nobody's perfect. Someone with the best this or best that has a flaw. Maybe it's not a flaw we can see, but it's definitely, most people always have something they worry about and they stress about. So try to find a nice little medium place where you can be happy, dance, get up, listen to music, read a book, write a journal. Like, there's so many things we can do to get our minds off of things that aren't that serious. Love yourself and love your friends and love your strangers, love that neighbor. I mean, that's pretty much what I have to say. Follow us on a Whitman-Walker, Facebook, Instagram, Twitter. And if you
Hmm.
have any questions, you can send a DM to Whitman-Walker. Anything we can do to help or answer, even if it's not about today's topic, feel free to reach out. Wash your hands, 6 feet distance, keep your mask on. You know the deal. David, thank you so much. Today was awesome.
Thank you as well, Orlando. And I always love doing lives with you. So I appreciate it.
So we'll see everybody soon. Stay tuned. We will be having more lives like frequently. So make sure you follow Whitman-Walker, follow David, follow me. We'll see you guys soon. Peace
Rachel
out.
says she's a car girl, and that makes her happy as right now. So, yeah, I
Oh,
mean, you have to find those things that make you happy. So,
for
good
sure.
job. All right. All
Okay,
right,
so we'll see
Lando.
you soon. Take care.
Talk to you later.